That is the beginning, 17. At what age and ending, what do you advise? Should it be?
There is no ending, madam. As long as they are healthy, they can go. For example, I have operated even 60, 70-year-old people also.
What are the costs involved? What is the minimum and what is the maximum?
But usually nowadays, the hospitals where we are operating in a corporate setup, an hour of surgery may cost you around 80,000 or a lakh of rupees. An hour of surgery. So how many hours we are operating is the second question. Why one should suffer like that when the technology is available in a safer way and in a perfect way?
So how to reduce what is the procedure to reduce the tummy?
Yeah, the tummy is depending upon the age of the person. Number one, usually we have.
So this ultrasound fat reduction is just dehydration, according to you.
Ultrasound means there is one technique in liposuction. The tip of usually the liposuction cannulus will be like this.
What is injection, fat dissolving injections, Andy?
When they put that particular medicine into a vessel, that can dissolve the fat plaques in the vessel.
Is there a simple explanation between Botox and fillers, Andy?
Your Botox is going to halt your muscle movement.
Yeah. So my first question was out of curiosity. I wanted to ask you, so the cases that you work on, what are the maximum number of cases? Would it be mostly maximum related to trauma, or otherwise it's mostly to do with, say, general aesthetic, improving aesthetic self of one?
Yeah, trauma cases we do get, but for my luck or unluck, I've been labeled as mostly like a aesthetic plastic surgeon or a cosmetic surgeon. So a lot of people come to me without a problem. Okay. In the sense, not medically having a problem, but it is something like when they have been labeled or when they have a low self-esteem. Those kind of people, they do come to me for correcting those kind of things. I don't say I don't treat a trauma like. I do have some trauma cases. But most of them, when they happen to have some correction done by me and when they happen to have a minor or a major trauma, they obviously wanted my service or opinion. So definitely in those issues, I do involve with trauma cases. Yeah, if you ask me, in plastic surgery, there are 4 or 5 branches. One is onco-related or cancer-related reconstruction. One is trauma-related. One is facial-maxillary, and one is hand surgery. One is burns, and one is cosmetics. So basically, I'm more into cosmetic field, though I being a plastic surgeon.
Thank you, sir.
And a couple of things what I have not covered is these are medical related and new innovations that had come into our life. Like nowadays, we have got some oral pills and injections for weight loss. So they are also contributing to us. Because olden days we have to remove the fat to make them somebody slimmer or trimmer. But nowadays that is been happening with the medicines. But however, after losing weight, there may be some redundant skin or loose skin, which is causing some unpleasantness or unhappiness. So in that kind of a situation, definitely again the surgical intervention is required.
What age group would you advise for people to do cosmetic surgery? Any of the procedures, whether it is hair, whether it is.
Usually we recommend them to complete their growth. For example, we do treat some hair lips or cleft lips and their age of 3 months or something like that. Because at that time, the child is not aware of what we are doing and what the precautions to be taken. So there may be little widening of the scar or whatever it is. Those kind of corrections, we advise them to come back around the age of 17. So by the time they complete their facial growth and body growth. So, and in addition to that, usually the 17 is the time where they're completing their college and going to undergrad or some kind of a change of their education place and other things. They don't want to go with the same remarks in their life to the newer friend circle. So that is the reason we recommend at that point, it is better to come for the definitive cosmetic surgeries.
That is the beginning, 17. At what age and ending, what do you advise? Should it be?
There is no ending, madam. As long as they are healthy, they can go. For example, I have operated even 60, 70-year-old people also, like tummy tucks or whatever it is. But the only thing is, we are going to check their health thoroughly, including their heart, kidneys, liver, whatnot, lungs, everything. And in addition to that, we would like to operate in a place where we have all the standby facilities like a cardiologist availability or a lung a pulmonologist availability or something like that. Sometimes we may come across little borderline complications when we operate on a very elderly people. I'm not saying, but as I'm saying once again, if there is a real problem which cannot be corrected, we don't operate on them. Only when it is possible to correct or control the problem, then only we are going to operate. That is the reason. That's what I am saying. Touch wood, we never had any untoward effects of the patients in my career so far. So we'll be very, very careful, even if it is a hair transplant. We recommend them to sleep well before the procedure. So such kind of finer precautions. When they don't sleep well or extend their hours the day before the procedure, on the procedure day, they may bleed a little bit more than normal. There may be some BP shooting up because of inadequate sleep and other things. So these kind of things are very much to be taken care of.
What are the costs involved? What is the minimum and what is the maximum?
There is no minimum and maximum, madam, because it is a kind of a thing. Because it is not like an essential thing for life. It is a kind of a some added thing to your life. But usually nowadays the hospitals where we are operating in a corporate setups, an hour of surgery may cost you around 80,000 or a lakh of rupees an hour of surgery. So how many hours we are operating is the second question. That varies from patient to patient. For example, if you ask me what is the maximum time I operated at a single stroke on a patient means 16 hours non-stop.
My God.
So, but it is quite safely. I'm not saying by taking risk or anything like that. We don't go like that, but when it is required, there are times we operated. Usually 5 hours is a very normal kind of a surgery for me, not a very extended one. But sometimes we do operate long hours also.
And how cosmetics can support social and mental wellness, social and mental well-being?
Well, sir, because a young girl being labeled as with some nicknamed with some cartoon character or some kind of a thing. Yeah, like a prominent eyes there in the Western world, they call Mickey. Fortunately, in India, we don't label them like that. We think that prominent ears means we call it them as like a Gandhi. So India is a country where people are not labeled with wrong things very often. But however, society is always going to look at you with the wrong things. So if a particular person having a kind of a little crooked nose or little humpy nose or some kind of a thing, yeah, definitely that is going to take away some self-esteem of that particular person. Coincidentally, since you have asked me, though I have not showed that the slides, but verbally I can discuss with you. One girl came to me, she's a software engineer. She came to me and she said, "Doctor, nobody looks at my face. They stare at my chest," because she has a very huge, prominent breast. So in that kind of situation, she never used to go and mingle with them in any of their team parties and other things. So those kind of things, definitely they are going to come out of that kind of a thing. The opposite of that is, there is a girl in the college, and whenever she is entering into the classroom, the boys murmur that this girl is from the Manchester. Do you understand?
Yeah, of course. Thank you very much.
Yeah, so a girl being labeled like that will definitely have a less self-confidence. So why one should suffer like that when the technology is available in a safer way and in a perfect way?
Have you seen a change in the kind of people that come to you? Is it younger people? Is it older people? Is it people from different economical status? What kind of people come to you, and for what kind of reasons?
Yes, madam. Once upon a time, when we started, there used to be a lot of taboo like that. Okay, people never used to admit that they have undergone cosmetic surgery. For example, even the hair transplants, men hair transplants, once upon a time, even when it comes to any kind of a marriage negotiations or something, they used to say that, oh, this boy has got a hair transplant done, or this girl has got some a weight reduction procedure done, or something like that. But nowadays it is very common, and people are not going to uh, take it that seriously. That is number one. And number two, the spectrum of the people. Well, the spectrum of the people, sometimes we ask them to not to come so early also, because sometimes they come with a very small children saying that, can you correct this, can you correct that, or can you, she's getting some kind of adolescent these things. So usually at that time, we'll say that usually in adolescence, they may be a little bit clumsy, but over a period of time, they are going to correct by themselves because of once they become mature, they'll have more firmer way of thinking. Because in adolescence, it is a kind of a peer pressure. Whatever their friends does, they want to follow, or they want to look at the ads and they are being mesmerized by them. So all that kind of a things. So, and old age, yes, even in the old age, it is not like a Western world. The Western world, maybe because of the different family pattern and our traditional family pattern, the demands may not be that much, but still some people do think that what is wrong in wearing a nice shirt or wearing a nice, presenting with a nice skin or a nice way. There's nothing wrong. For example, if you look at the dentistry, once upon a time, only the film stars used to get the teeth cleaning done. But now everybody thinks that once in a year or a couple of years, they go to a dentist and they say that just give me a teeth cleaning. Like, there's nothing wrong. There's nothing wrong. Of course, as long as the technology is safe, they don't spoil your teeth or your dental cover or such kind of things. You should avail the availability of the technology can be availed.
So which age groups come mostly in the 10, 20s or the 30s or the 40s or the 50s? Which age group comes?
Yeah, in India, especially the before marriage is a most demanding, because they want to look better in somebody's view. I always try to discourage them, saying that because of this surgery, don't ever think that you are going to have a, because our custom is mostly it is a kind of a marriage that happens out of what do you call family oriented marriage, arranged. Okay, kind of an arranged marriages. People do come to me saying that I don't have a good nose, that is the reason I'm being rejected by girls, or I'm looking black, that is the reason I'm rejected that way, this way, or lack of hair. So those kind of people are more. But once the other kind of people is once you have a financial stability also, when you think that why can't I invest on myself? That is a second category of people that are coming in India because of our social revolution or financial independence.
So what kind of economical status people come to you? What kind of income group people come to you?
Yeah, if you ask me like that, only who can afford to have, only they can, because these procedures are not covered by any medical insurance or Mediclaim or Medicare or any kind of things. Of course, if it is a trauma-related one, they are being covered. At times, the trauma-related, if there is some facial injury, they also request to do some kind of a nose corrections and other things. We'll be able to do some portion of it, but not everything of it in those kind of surgeries. By and large, yeah, one has a financial stability or comfort line only. They only can think of these things. Because we don't have financial facilities for these kind of procedures in India. But whereas in the Western world, like your car finance and house finance, they finance you on cosmetic procedures also, depending upon your pay slips and other things.
You've been speaking about the skin. Do people come for color change? Is it something in that area also?
Yeah, not color change, madam. The funniest thing is the most people, they label them milky or white or whatever it is. Even they do come and they take those glutathione injections, saying that they want to retain their complexion. Right?
How is it?
Yeah, it is not only the people who are other side of the color also, not like that. And I usually tell them that don't ever think that black somebody very dark is going to turn into very fair like. But when you give the vitamins in an optimal way, basically in medicine or in dermatology or in plastic surgery, what we talk is a healthy skin. Healthy skin doesn't mean that it should be fair in color. Healthy skin means a uniform complexion of the color, or a skin without any blemishes or any marks or any kind of unwanted things. So that is called healthy skin. So, but unfortunately, in a colloquial way, that is taken in a different style. So people do come and they ask, we explain them. We don't give them any guarantee or any kind of a thing. So maybe that is the one aspect. Even my friends always tell me that I never promote anybody for any of these kind of things in a prominent way.
You said obesity. And these days, there are a lot of people who are using Ozempic or Mounjaro, and there's a lot of concern about it in the market.
Yes, madam, because basically, like any medicine, when there is an effect, there has to have a side effect. For this Ozempic-like medications, they have noted blindness, they have noted pancreatitis, whatnot. There are so many issues are there like that. But basically what I can tell is, that is the reason, for example, in a country like America, these things have to be are given as they advised by the doctor only when they qualify to certain levels, like when they have a BMI is more than 36 or 40 BMIs or something like that. But unfortunate thing in India is, in India, the pharmaceutical market is not under good control very much. The minute I have a prescription in my hand, I can share it with you, and you can also send a person to with some cash, and he can buy and get the same medicine for you. That's what is happening in India because of the swapping of the prescriptions or sharing of the this thing and uncontrolled selling of the medicines. Because the minute he receives the money, he's going to hand it over. It is not like a controlled products. So that's where all these problems are raising. But when it happens under a proper supervision, I don't think we don't come across these kind of gross health issues.
There is a question from Mr. Divakar Lingam. Dr. Gary, you're doing a lot of good work. Thanks for improving the confidence by changing the appearance. Do you do keloid? Would you like to ask your question yourself?
Yeah. Keloid, number one, if it is possible, we'll try to remove the keloid and try to correct it in such a way that they should not re-happen like. Because usually keloids happen when there is an infection in the body, or suppose if the scar has happened because of the accident on a road or something where there is a dust. So second time when we are operating, we are going to do it in a cleaner way. And number two, if they are overweight, I will ask them to reduce the weight, because obese people will see keloids more. And number three, we try to use some kind of a suture materials which are inert and less reacting with the body. So with all these things, sometimes we do remove the keloids and we try to give them a better appearance. And once, despite all these things, if the body has got the tendency of developing keloids, then there are certain creams, certain gel pads, and also there are some injections, intralesional, Kenacort like Translan injections. So we institute all these things to control them. And in a very aggressive cases, like earlobe keloids, we may put them for radiation therapy also. Nowadays, oncological radiation oncologist support also we do take to reduce that keloid count.
Do you have any pictures to show us what keloid is, sir?
Pictures of keloid?
Yeah.
Yeah, I do.
సిజేరియన్ చేసినప్పుడు పైన వస్తుంది. Got it.
కొంచెం ఉబ్బినట్టు వచ్చి దాంట్లో దురద కూడా ఉంటుందమ్మా. Some people they have itching also.
Right.
So and redness. So in that stage, probably we may advise them to go with a Kenacort or Translan injections. Intralesional we give once in 3 weeks to reduce that flare up.
So
Thank you, Divakar.
for people who are obese, would you suggest medication or a bariatric surgery? Beyond, you said beyond BMI 36, you would suggest something. So how do you evaluate what's correct?
Yeah, number one, we need to counsel them thoroughly. If they have a habit of consuming a lot of volumes of food, definitely bariatric surgery is going to help them. Because despite taking the medication, if they continue eating, probably they don't find much improvement. Because some people that hunger cycles are so strong, unless they eat that much, they won't be very, very happy. Their brain won't feel happy. So in such kind of a situation, definitely bariatrics is advisable. And even if you look at the other side of the story, you were asking me questions about finances and other involvements. For example, these Mozambique-like things is going to cost about 15 to 20,000 a month. So they have to use it for 6 months minimum. So in very obese people, even they may have to use some baseline medication further down the lane. So with all these things, financially, it is also going to cause a lot of burden on their pocket. But whereas the bariatric surgery, though it is a single-time investment, it is going to be a lifelong and definitely going to deliver the things like, recently one of the girls who got it done, I think she lost about some 35 kgs or more.
With bariatrics?
Yeah, with bariatrics. So I told her that now you are walking without a international business class suitcase.
So, I mean, how long does this process of losing this 35 kilos take?
About a year.
Okay. About the hairline, how safe is it, the hairline surgery that you're suggesting, and how much would it cost?
Yeah, cost factor varies from place to place. By and large, in Hyderabad also, there are few places they are charging too exorbitant prices, which is very unethical, or maybe that's all for few people. But about a couple of lakhs it is going to cost. And safety margins, again, we have to counsel individually. Recently, I happened to have a couple of senior citizen patients came for hair transplants. Despite my advices, one person came by crossing the advisory things. We faced a little bit of bleeding at the time of procedures. So basically what happens is it is going to hinder our technique or the quality of the procedure. So the other patient came in a very proper way, and he came early and took all the advices and followed precisely. So we could able to perform the procedure as per our expectations. So like that, every patient we have to counsel, we have to see what is the medication they are taking, any blood thinners or any other associated things, what is his BP, which way we can control it, and all those things. And suppose if somebody has got diabetes factor, how good is his glycosylated hemoglobin, and all those things we have to take into consideration.
In all the procedures you've talked, whether it is hair, body contouring, or the eye, mouth, which of these surgeries is the most risky?
There's no such thing, ma'am. But the thing is risky in the sense we should evaluate the patient properly. Because sometimes what happens is this is not a disease. Patients come in a rush saying that I'm coming tonight, I want the procedure tomorrow morning, something like that. For example, for hair, people come from abroad. So they come with such a tight schedules. So usually in that kind of a situation, we should have a patience to ask them to relax first and then come for the procedure rather than coming without sleep and without this thing and without proper evaluation and that kind of a stuff.
Medical tourism, what is the opportunity for this plastic surgery, the profession in India?
Yeah, definitely it has got a definitive role. But unfortunately, the thing is, the India is being aimed by only the Indian people living abroad, like NRIs, non-resident Indians, and a very small portion coming from African regions, and even that African regions also, majority linked with NRIs, because since I go to Ahmedabad, a lot of Gujarati population, they have migrated to African countries. So the pure Africans coming to India for health reasons are increasing. Still the cosmetic reasons, not that prevalent, but very few are coming. I had an opportunity to operate on some VAP stain from Africa. So, number one, the marketing network has to increase. The sense the patients they are coming should have a confidence that we are going to get a world-class treatment here. And number two, they should not be because usually in India what happens is usually they come with a some mediator or a broker kind of a thing. So they try to extract more money from them, and that kind of a situation should be avoided. And there should be transparency between the patient and the doctor. Then probably the things will work out in a better way. And still, a lot of Western countries, they still think that India is not up to the mark. Like, I do agree, not everyone is equivalent like, but in India, when you happen to know where to go and from whom to get the treatment done, probably you get the better treatment and a quicker treatment than America. But in America, wherever you go, you get the standard treatment without a second question asked whether you are a VAP, whether you know the doctor or not knowing the doctor. So that kind of a quality has to increase in India.
So this question is on behalf of men, sir. So how to reduce what is the procedure to reduce the tummy?
Yeah, the tummy is depending upon the age of the person. Number one, usually we have, I didn't discuss in detail, we have some fat layer underneath the skin that can be removed with the liposuction or, basically liposuction. Suppose if there is a fat behind the muscle or inside the abdomen, then probably we had to go put him onto the weight losing mechanisms. Either it is exercise or diet or Ozempic or that kind of a medication or the bariatrics. So once they lose the intraperitoneal fat only, we can placate the muscle. I showed one picture where you didn't see much improvement after liposuction. The reason is he has a muscle looseness. If I have to tighten that muscle, the inside fat also has to reduce. Otherwise, they'll have a pressure coming onto lungs and respiratory embarrassment, and that kind of situation will prevail.
So once you do liposuction, so what is it? Do you have to tighten the skin also?
That also depends. Usually with age, when the skin lost its elasticity, then probably we may have to tighten a little bit. When they wanted a very tight and a neat skin like. That depends upon the patient's demands. Right? So if they happen to have, if they want to act or work in front of the camera, probably they need a more smoother skin. So in that case, we may have to tighten the skin.
Does it leave any big mark on the stomach? Or?
Yeah, it is going to form a scar underneath the bikini line. We try to hide it underneath the bikini line. Usually, whether you agree or not, most of the people, because of the elastic band of the underpants, will have a little darkness there. We'll try to fix the scar into that dark area. So it's not that hardly seen, but definitely it is going to be seen. If you ask me, is it seen means, yes, I have to agree that it is seen.
Okay. Thank you.
This question is from Mr. Kishore. Good session, sir. How far glutathione useful, oral, and 4 differences based on their action? I didn't, since I'm not a medical professional, I don't know.
Yeah, glutathione, all these are subjective matters, ma'am. As I said, one with a very dark skin will not become very fair. Usually, I tell them this example. If you give a proper fuel to your car is going to run optimal. If you give a polluted fuel to your car, it cranks more and its performance diminishes. In the same way, when the vitamins are not up to the mark in your body, probably it shows on your skin with a little bit of patches, with a little bit of dullness and other things. So when you give vitamins, that portion will be recovered and that is going to appear in a better way. For example, even if you pour aviation petrol into your car won't fly. This is the jocular way I put them like. So in the same way, even if you take excessive vitamins, more than required also, don't ever think that somebody with a dark shade is going to turn like into very fair shade, like one of the movie like Shivaji, that Rajnikant's. It is not going to be like that.
So what is cool sculpting, fat freezing, cryolipolysis?
Yeah, that is another marketing tool because the people say that without a surgery, without this thing, you can reduce weight. But the thing is, I have my own concerns about the technology and outcome of that procedures. Suppose if you freeze the fat, it is going to dissolve. My basic question is, somebody living in polar areas should have been very thin. Am I right, madam?
Absolutely.
Okay, but the creatures that are living there, the seal and other things, they are the one who lives with the maximum fat. Okay, suppose by subjecting them to that freezing temperature, the seals should have been very thin creatures. So I don't think just by freezing the fat is going to dissolve, number one. And number two, usually they apply some cups when they want to freeze. That is going to suck your skin inside, and that is going to cause more laxity of the skin. So at times you may end up with the loose skins more when you subject yourself to this cool sculpting or gel tech and all those kinds of things like.
What about radio frequency body contouring? What's your opinion on that?
Yeah, radio frequency, all these are more or less same. In the sense, radio frequency, mostly it is internally we need to pass that energy and we need to burn the fat
Is it
so, yeah, it is also part of the, but at the end of the day, you need to suck out the fat. Okay, you are burning the fat and you are sucking out the fat. Usually we try to put a lot of liquid into the fat and we suck out the fat. That is Galton's and liposuction. So hydrolipo is there where you put a lot of water and you try to suck out the water along with the fat So these are various techniques but at the end of the day, we need to suck out the fat.
So what are the non-invasive techniques by which you could do body contouring?
Yeah, the cool sculpt you said, but according to me, I'm not very convinced.
Cool sculpting and the radio frequency, is there anything else? Ultrasound?
Genetic is there. Genetic also with the same temperature variation kind of a thing only. And normally, most of the spas, they give you this steam therapies. So they dehydrate you and they show you on weighing scale, you lost 2 kgs, you lost 3 kgs, something like that. It is just a half-a-day job, you are going to recover that. Once you go back and you drink adequate water, you are going to come back with it.
So this ultrasound fat reduction is just dehydration, according to you?
Ultrasound means there is one technique in liposuction. The tip of usually the liposuction cannulus will be like this, like a pencil So the tip, there is some ultrasonic waves coming. And when we pass it underneath the skin, when it goes internally, it kind of burning the fat Okay, so even in that, let me tell you, initially they said that this burning is going to reduce more and more. But when they come and when they touch the skin like this, it is burning the skin also. You can see some skin burns. Okay. And number two, when you go and touch the deeper part of your body, you are going to burn the muscles or some vital structures. So, and in addition to that, I showed you one slide where we do body sculpting, where we transfer the fat, wash the fat, and put the fat inside. So at that time, we want the fat cells to be relatively viable fat cells. So these people have created some papers saying that even after burning also, you can use that fat for repositioning or replacing but which is not a very correct way of looking at things. When you are burning the fat, obviously you are going to damaging the fat. So all these are questionable technologies.
What is M-Sculpt?
M-Sculpt.
Yes, muscle stimulation, building muscles set to burn fat, using electromagnetic energy to cause deep muscle contractions.
No, usually when there is an abdominal laxity, they put some leads on the muscles and they stimulate the muscles. Let me tell you one thing, ma'am. If the fat, suppose if you work more, that is going to burn your fat means you should have less fat on your right hand and more fat on your left hand. Because I'm a right-hander, I use my right hand more. So do you think that my right hand has less fat and the left hand has got more fat? Okay, so the simple answer is the fat doesn't give the energy to the muscle sitting next to it. So even if you do like your finger like this for 10,000 times a day, it won't become like your little finger. It won't become thin or it won't become fatless. Okay, only your muscle is going to improve. So the fat, when it has to become a activated molecule of energy, the fat has to first enter into the blood circulation, and then it has to go into the liver, then it has to go into the lungs, then it has to reach to the muscle cell, then it can liberate energy there. It is not going to be, suppose if I work with my left hand becoming thin. If I work with my right hand becoming thin, doesn't happen. So that is also a baseless concept.
What is injection, fat dissolving injections, Andy?
Yeah, these are phosphatidylcholine injections are there. The research, what they have found is when they put that particular medicine into a vessel, that can dissolve the fat plaques in the vessel. And that's how you can avoid the strokes or some kind of a health conditions like. Okay, so the same thing, some of the aestheticians, they found that why can't I put it underneath the mandibular line or a jawline to reduce this one or into the festoons I described like. But the thing is, there is no quantification how much of medicine is dissolving how much of fat. Or is it dissolving in a uniform way? Because when we are looking at the things, you should have a uniform contour, even at the submandibular area or at the infraorbital area and that kind of a thing. So how you are going to see that this particular medicine is going to dissolve that area in a smoother way. Okay, so those quantifications are not there. So by and large, these are hepatotoxic drugs. You cannot inject this drug in a very high volumes. Suppose if it is a small areas like this or like here, it is okay, but not like chest, not like abdomen, not like thighs or hips of very high volumes of fat.
Is there a simple explanation between Botox and fillers, Andy?
Yeah, Botox is going to halt your muscle movement. That's how we are reducing the wrinkles on the face. Whereas the filler is something like where there is a weight loss and where there is a deficiency of fat. To fill that fat layer, we are giving fillers. For example, like a cheek prominence. When they emaciate more, there may be a loss of fat volume on your cheek. Then probably we can give filler, not the Botox. Botox is for frown lines, for crow feet, or any muscle-related activity. Of course, we give Botox for underarms also to reduce the hyperhidrosis or sweating conditions. Nowadays, that is a very popular thing in among the urban population, especially girls, going with Botox into underarms to avoid sweating and damaging their dresses and other things.
A lot of actresses who have actually done these treatments, suddenly they lose their facial expression. What do you have to say on that?
Not facial expressions. They try to reduce some amount of wrinkling happening on the face because that's what is going to make them look older. So I don't see just by reducing the frown lines or something, their expression is totally gone. Like, yeah, even if somebody comes up with that kind of a question, we can reduce only horizontal lines, avoid vertical lines, not being influenced by Botox. We can customize accordingly so they don't lose their expressions. In fact, I would like to say that they are going to appear because basically the more wrinkled is more aged. The less wrinkled is less aged. So somebody wanted to look less aged. So obviously we had to knock off some of the wrinkles.
I suppose I've covered pretty much most of the questions, Andy. Thank you so much. That was a wonderful session, a very enlightening session for the common man. Thank you so much. And thank you to all the participants.
Thank you.
Thank you to the team for a wonderful session.
Yeah. Thank you, sir, so much. Thank you so much for your time. And thank you to all the participants for gracing us with your presence. Sir, you've been doing amazing stuff by removing insecurities from people's hearts. You've been giving a gift of confidence and morale boost to people with your profession. And